The overall goal of the following experiment is to provide practitioners who treat women with pelvic pain an easy method to highlight the presence and extent of subtle endometriosis. This is achieved by first doing a survey of visible endometriosis to identify obvious disease. As a second step, methylene blue dye is applied, which shows areas of subtle endometriosis that might be missed by normal laparoscopy. Next, all blue-stained areas are resected to completely rid the patient of disease. Results are obtained from scanning electron microscopy that show that this approach removes invisible endometriosis that affects the underlying peritoneal cells, which in turn provides menstrual or ovulatory blood access to the sensory nerves that innervate the pelvis, causing pain.
The implications of this technique extend toward both the diagnosis and treatment of endometriosis, as it allows us to identify subtle and even invisible endometriosis that might disrupt the peritoneal surface and allow blood to have contact to the nerves underlying the tissues, explaining the pain that these patients are experiencing.
Normally, at ovulation or menstruation, some blood will enter the pelvic cavity. The lining of the pelvis and abdomen contains an intact sheet of mesothelium that prevents this blood or the factors within blood that cause pain to interact with sensory nerve fibers. In women with endometriosis, the inflammatory endometriotic